Now, there are many factors that affect the risk of hearing loss. First of all, is the intensity of the noise. What is the sound pressure level? How many decibel is it? And then what is the type of noise? Is it a wide band, a narrow band, or an impulse? And what the duration of the daily exposure? How long are you exposed to the sound? And then in total, let's say in years, number of years, what is the total duration of that exposure? So this is why age of the individual, as you age, you start to have hearing loss. Is because of this total duration of exposure in years that you have been exposed to that much noise. Because it's like wear and tear, so the hairs also they get weak as you age. And then coexisting hearing diseases, if you already have some kind of hearing disease, so it can affect your it can cause hearing loss. And then with the nature environment in which the exposure occurs, also sometimes temperature, if you have abrupt temperature change or abrupt pressure change, that can also affect the hearing. And then the distance of the person from that source of the noise. Are you really close to it, or you are in a safe distance? And what is the position of the ears relative to the sound waves? Do you have earmuffs on, or is it protected or not? Okay. So if you see here, the scale shows that the different decibel of sound and what sort of effect that can cause to the hearing system. Let's say that, so we know that the permissible exposure limit is the OSHA action level is 85 decibel. So at 85 decibel, prolonged exposure can cause slight hearing loss. And this is when hearing protectors are recommended to be used. At 90 decibel, prolonged exposure can cause mild to moderate loss, and you need hearing protectors. And then as we move on to 100 decibel, even a short exposure can cause permanent hear loss, while noise higher than 100 decibel, you might need dual protection. For example, you will need to have earplugs plus earmuffs. Okay? And pain threshold is 140 decibel. Okay? So the National Institute of Occupational Safety and Health recommends that occupational noise exposure must be controlled so that no worker is exposed in excess of the limit set. If we look at this chart, it shows that the higher the decibel, the higher the noise, the shorter the permissible noise exposure is. For example, exposure to 100 decibel noise is only permissible up to 2 hours only. But a 92 decibel noise, this is, for example, like the hair dryer or a blender, you can be exposed to it for 8 hours in a day. So noise hazards, how do we minimize adverse effect on hearing? It should be minimized. So we have to avoid noise sources before they are being introduced into a work or other environment. This is what you can do. If there is noise, you can replace equipments or process or materials with quieter ones. But let's say if the noise cannot be replaced, we can try to modify them, put some noise reducer, and maybe you can modify the sound so that it's being distributed to the environment. Yeah. So let's say, so these are the different possible noise control procedures that we can do to minimize the adverse effects on hearing. Source at the path or at the receiver. At the source, you can modify the source, or you can redesign so that it doesn't produce too much noise, or you can relocate this to somewhere else. in the pathway, what you can do to control the noise is by building an enclosure, like a wall. You can build a wall so that the noise will not be received by the receiver. You can also build a special wall using some kind of insulation so that it absorbs the sound. Okay, or you put these barriers. And then at the receiver end, what can be done is you can put this person in an enclosure so that he won't receive the noise. Okay, and provide sound absorption. You can have things as simple as curtains, carpets. Those can absorb noise, and also you can relocate this person. Alright, so at the source, you can treat the source. How do you treat the source? You can put an enclosure. For example, you can put enclosure, which is a sound absorptive treatment. You can change the process. You can substitute the equipment, and you can also alter the design. You can treat the pathways. For example, you can include some absorption in the room. You can place barriers and shields. You can even move the equipment to a different place. And at the receiver end, you can do some administrative changes. You can provide ear protection devices and put the person in an enclosure. So there are different types of ear protection devices. The least expensive option would be the disposable earplugs. However, earplugs is not sufficient for higher decibel. You need to have earmuffs because it is more efficient. However, it is slightly more expensive. There are many different earmuffs which gives different level of protection. And these protecting devices have a noise reduction rate, which is the NRR. And this NRR is an indicator of how many decibels it can reduce the noise. For example, earplugs have an NRR range of 26 to 31, while earmuffs have a higher NRR from around 23 to more. For example, if you are exposed to 100 decibel noise, if you have earplugs on, it can reduce it by 20, 25 or 30 decibel. So it brings it down to 70 decibel.